Hello everyone, good morning. My name is Dominika Kozak. I am a clinical specialist in EGZOTech and I would like to warmly welcome you on today's webinar. I hope you can hear me well and see me well. So today I would like to talk to you more about the research and how actually LUNA EMG can be used for research purposes, because a lot of you ask us about how can you use LUNA for research, what data can be collected, how can we implement LUNA into the study design. So today more about it, and let's talk a little bit about the research background. So I will start with the evidence-based medicine. So according to Sackett, evidence-based medicine is the explicit, judicious and reasonable use of modern best evidence in making decisions about the care of individual patients. So the evidence-based medicine integrates inside the clinical experience and also the patient values with the best available research information. So this is the main definition of evidence-based medicine, but a little bit more appropriate in our clinical context when we think more about the physical and rehabilitation medicine. So we then look at evidence-based clinical practice, which definition is the integration of best research evidence with clinical expertise and patients' values. So what actually is evidence-based medicine? It combines the clinical judgment made by the clinicist, by the specialist, with relevant scientific evidence, which you can find in many research databases, which I will also talk about a little bit more, and also taking into account patients' values and patients' preferences. When thinking about the research, we think also about the study design, on how would we like to plan the study, what are we going to measure, who is our target group, how can we actually organize the intervention. And for that, very useful might be the PICO format. And PICO is the process and the technique used in evidence-based medicine to frame and answer a clinical question in terms of the specific patient's problem that helps clinically relevant for evidence in the literature. So actually PICO comes from the first letters. So P is for patients or problem. And here we should find out how would we like to describe a group of patients, like who is the target group. I is for intervention or indicator, so we think about which main intervention am I considering. C goes for comparison or control. So what is the main alternative to compare? Who would be my control group to whom I would like to compare my study group? And outcomes. So the last letter, it's O. Outcomes. What do I hope to accomplish? What outcomes can I get from the patients after the intervention? And when planning the study, when answering several questions we should be very, very specific from the very beginning. A little bit more about the PICO. So this clinical question composed by the PICO formula will help us to focus our search and finding the best available evidence. So the most common PICO elements is P, like population as well. So how you would describe a group of people with a similar problem or similar compliance. I, like intervention. So how you plan to treat, how to plan to medicate, to diagnose, or to observe patients. C for comparison. Of course, it depends on the type of research. So if we want to compare between the groups, then the main intervention alternative you are considering. So if we are comparing the intervention or non-intervention, or we compare one intervention into another one. O for outcome, so the result from proposed treatment that is measurable and includes improvement of symptoms or no symptoms or no complication. Another additional letter is T, like time. It's sometimes applicable. So this goes for the time frame of treatment and the measurable outcome. There are several databases, clinical databases, from which you can actually collect a lot of data regarding the research for about many different topics, many different issues. So the main, the most popular is PubMed, and you can also use the Google Scholar, and also there is the NCBI, so the National Center for Biotechnology Information, and they all combine the evidence-based medicine articles and publications to which you can like compare your study, or which you can like have as an example of the possibilities of your research. But we need to know that not all studies actually are equal. So there are a lot of research and many kinds of research studies. So by knowing which kind and how big is the study is the key for us to understand their significance. And we can divide the study types in health science from between observational and experimental. Not all research studies are created equal, and this is done by purpose. So the study type is a key component that should be used when assessing the importance and potential impact of research. So the more experimental the research is, the bigger, the higher impact, and the bigger strength of conclusion comes. A little bit more about the study types. I will start with the observational studies, which are the lower on the pyramid. So this is the study where the researchers do not really intervene. So they simply observe the study subjects. They want to determine whether there is any correlation between an exposure and the disease within a given population. So the results of such studies can help guide and inform more in the prevention research. When we go to the study design, observational studies can be either prospective or retrospective. So prospective, these are the studies which are forward-looking. So prospective studies observe a group or compare different groups over time. to look for any relationships between the lifestyle factors or environmental exposures and the development of condition or disease. And the data are collected at the baseline or at the beginning of the study or before the disease is being diagnosed, and any changes are documented for the study purpose. Whether the retrospective, so the backward-looking studies, rely only on study subjects who have already been diagnosed with a condition or with a disease, so they are called cases, as well as a comparison group of subjects who do not have the condition or disease called controls. So here we have two groups. So cases and controls are then asked about the past exposures to tease out any association between exposure and the disease. Another type of the research studies are the case-only studies. So the case-only studies, they look for interactions between the effects of some environmental factors on a disease using data collected from patients with the disease who are known also as cases. And cross-sectional studies, they examine the relationship between an exposure and a health outcome within a specific population at a single point of time. So such studies provide a little snapshot of activity, but often cannot determine which came first, whether it was the exposure or the disease. Case control studies. This type of studies compare two groups. So those with a disease or a condition of interest, so cases, and those who are similar in age and other demographic characteristics who do not have the condition or disease. So here we have the cases and the control group. And then the researchers compare the frequency of exposure prior to the disease diagnosis to one or more risk factors in both groups. The studies which we as a physiotherapist, as a researchers in the rehabilitation field are interested the most are experimental studies. So experimental studies are very, very high on the research timeline, and they get really a lot of a lot of good knowledge about the subjects. So experimental studies are called the randomized control trials. So you can find it as RCT. And here you assign groups of people at random. So like the toss of a coin to either receive or not receive a preventive or therapeutic intervention or screening test. So this can be drug, or this can be device or a procedure or the intervention. And here the researchers assess the impact of the intervention on those who receive it in comparison to those who did not. So here basically we have two groups. One receive the intervention and the control group do not receive the intervention. Another type of study, these are the cohort study. They always look at the large groups of people. So it's mainly to understand the causes of a disease or of a condition, and they might be prospective or retrospective, and most often the information on exposure is collected at the very beginning, so at the baseline, and then the individuals are followed up over a period of time to determine who develops the disease or who develops the condition of interest. Randomization. When we talk about assigning people to the research for the research study, to the research group, we need to talk a little bit about the randomization. And randomization is the process of assigning clinical trial participants to the treatment groups. So randomization gives each participant a known, so an equal chance of being assigned to any of the groups. And when we have successful randomization, to have successful randomization, we require that the group assignment cannot be predicted in advance. What is the need of randomization? Well, if at the end of a clinical trial, any difference in outcomes occurs between two treatment groups, so we compare the intervention and control, so we can explain it in several ways. That the intervention exhibits a real effect, or the outcome difference is solely due to chance, or there is a systematic difference or any bias between the groups due to factors other than the intervention. So here, randomization aims to obviate the third possibility, so if there is any difference or bias. There are three main criteria for randomization. The first is unpredictability. So each participant has the same chance of receiving any of intervention. Allocation is mostly carried out using a chance mechanism, so that neither the participant nor the investigator, so the scientist, will know in advance which will be assigned. Another criteria is balance. So treatment groups should be of a similar size, constitution. Groups are alike in all important aspects and only differ in the intervention each group receives. And the last one is simplicity. So we need to make it simple and make it easy for investigator, for the scientists, for the researchers who are involved in the study to implement. Of course, randomization can be done in many inappropriate ways. And for example, assigning patients alternately to treatment group is not really a random assignment. Assigning the first half of the population to one group is also not a random assignment. Assignments by methods based on patients' characteristics such as date of birth, order of entry into the clinic, or day of the clinic attendance are not also reliably random. When we want to include patients into the study group or the control groups, we also should focus on inclusion and exclusion criteria. And these are the conditions that must be met in order to participate in a clinical trial, or the standards used to determine whether a person may be allowed to participate in a clinical trial or not. The most important and the most common used criteria includes the age, sex, the type and the stage of the disease, the treatment history, and other medical conditions. So we also think about what should be, what patient's condition, which patient stage should be excluded, because then it doesn't really make the group similar and clear. What I also want to point out during this presentation, because we face this problem many times when we would like to publish the research, especially for the impact factor manuscripts, there is the clinical trial registration database. This is the clinicaltrials.gov. And you should always remember that this clinical trial registration must be done before the study participants are being recruited. So we can have the study plan, we can have the study design, we can have the ethical committee agreement. I'm sorry. But then, before we start the study, we should register it for this database. Otherwise, our research might not be accepted for the publishing. And we are also very happy to help you as a clinical team of EGZOTech in designing the study protocol. We can give you tips and hints on how to organize the research, and if you would like to make any research, conduct any research with the use of Luna EMG, just let us know, and we are really happy to help. So let's move forward for how can we implement Luna EMG into the research. So Luna EMG can be either the training, so the intervention part, or it can be also the assessment, so the diagnostic tools. I would start with the assessment. What can we assess with Luna EMG, and of course, which data can we collect? We can assess the muscle activity, because we have the very, very sensitive surface EMG. We can assess the muscle force by the specially designed isokinetic testing. We can also diagnose the proprioception by using the proprioception test. And we can also assess the range of motion by using the range of motion passive and active mode. The surface EMG gives us the information about the muscle activity. So even though the patient in MRC scale or the Lovett scale is assessed by on 0, we can have the very precise information about the maximal voluntary contraction of each muscles. How can we do this? We can we put the electrodes on the muscles or the muscles group which we are interested in, and then we can implement it in our testing or in our rehabilitation procedure. And on the screen we can see the muscle activity, and it will be also remembered and collected in the report after each exercise. Another possibility of the assessment is muscle force. So for that purpose we use the isokinetic testing. And we have a program which is called the dynamic reversal. It's the one of the orthopedic programs. So here the patient receives the resistance that he generates on the device. So the change in resistance fully adapts to the musculoskeletal system, pain and fatigue. Speed of movement and strength will increase. So the faster the patient move the extension, the higher resistance he gets. So the slower the movement, the lower the resistance. After each training, you can have the training report from which you can have you can collect several data like the range of motion, the maximum speed, the repetitions, the torque, and also the muscle activity and maximum volume contractions, of course, when the electrodes are in. The proprioception, so for this purpose we use the diagnostic joint position sense, and here we can also assess the range of motion. We can see the position and how does the position differs from the one we wanted to achieve by the patients and which was actually achieved. So for the proprioception test and training, we do have an example of LUNA EMG proprioception test. So we assessed 10 stroke patients and we got the results. So the biggest differences were, of course, assessed on affected side when the eyes were closed. Range of motion, for that purpose we created the diagnostic range of motion test, and for this purpose we can have the passive and the active mode, and it's applicable for all the extensions, so we can assess both the passive range of motion, and then we can ask the patient to start with the active range of motion, and we can, of course, here on the left hand side see the difference and what is the range. Yeah, so after the training you can have a summary, and you can also generate the report in which you will have the very detailed data. So what was the range of motion, what was the movement, and what is the difference between the active and the passive movement. Yeah, so the passive range, the active range, and what is the deficit. So very, very interesting, very useful also for the patient assessment for the research. What is also important that all the data which are collected by LUNA EMG can be also exported for the database as the CVS file. LUNA can be also used as an intervention, so we can have different kind of exercises, different kind of treatment for different kind of patients. The first is when there is no activity and no movement, so we can use the passive exercise, and then we can observe whether the range of motion increased, whether the patient started to generate any muscle activity, whether the proprioception was a little bit better. Another group of exercises is when there is activity but there is no movement, so the patient needs a little bit of assistance, and for that we use the reactive electromyography and the EMG biofeedback. And the third group of possible usability is where there is activity and movement, so the patient can actually exercise with the resistance, and for that we use the dynamic reversal and all the resistive programs, so elastic resistance, weightlifting, and of course the proprioception exercises. There are already some Luna EMG research examples which I want to share with you. The first one is that Luna was used as an assessment tool. So here is the study. Assessment of muscle fatigue, strength, and muscle activation during exercises with the usage of robot Luna EMG among patients with multiple sclerosis. So here the experiment was performed among 25 MS patients, and the assessment of MS patients was performed with Luna EMG. And here we observed the muscle fatigue, the strength, the muscle activation, and relations between them among patients with MS. So here Luna was basically a diagnostic tool. Another study, which was also presented at the Congress of the French Society of Physical and Rehabilitation Medicine, is the influence of EMG-driven robotic training on strength, muscle mass, and mobility using Luna EMG robot with patients after stroke. And here, the group consists of 48 patients after ischemic cerebral stroke in early stroke rehabilitation, so up to 3 months after the incident. And we divided them into two groups. So one receives the traditional physiotherapy, so the active exercises with a ball or with the therapist, and Luna EMG. And another group received the traditional physiotherapy and a lower limb rotor. So the sessions were carried out 5 times per week for half an hour, and for a total 6 weeks. And we receive nice results that the patients improved in the functional scale, and the knee flexors and extensor muscle force increased as well. So for now, thank you for your attention. I am happy to answer your questions. If there are any questions, just please let me know. If you're interested in designing a research plan or to implement Luna into the research, you can always write us an email on EGZOTech. There is the webpage, EGZOTech.com, and you can contact us directly. We are free. In the clinical, there are 3 of us in clinical team. So there is Anna, which you already will know, and Kasia, another friend, and me. So we are really happy to help in organizing the research and sharing you our knowledge. Okay, all right. So if there are no questions, yeah, thank you, Mahesh. I'm really happy that you enjoyed I hope that you enjoyed the presentation and that it gives you a little information about how to use Luna EMG for the research. And there is a question. Okay, everything was clear. Yeah, so thank you very much. Have a good day and have a good rest of the week, and stay safe and stay healthy. Thank you. Bye-bye.